Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual, and today some more rules in clinical care tips category. Rule number 135. Every rhinovirus is high fever. Don't let that scare you. I guess it's something about kids that makes them highly febrile from very benign viruses. Not sure why. I think there are several explanations to it. One of them that I particularly like is the fact that kids have very normal reflexes and very strong reflexes in general. For example, they can become very tachycardic and have very good peripheral constriction that allows them to maintain their blood pressure for a very long time. Again, tachycardia being a normal physiological response is very strong and very emphasized in children. Another example is the gag reflex. Kids have very good and very strong gag reflex. It's something we lose with age, which is why kids vomit very easily. You don't see post-tussive emesis in older children and adults, but kids from every benign cough or a little cold very easily get post-tussive emesis. Fever is, I guess, no different. Kids become very febrile from very benign cold viruses. I guess another explanation is maybe the fact that kids are not immune to all those viruses in the environment, and it's something that their immune system has never seen or is seen for the very first or second time. That's why every benign virus causes a very exaggerated immunological response, and it is something you lose with age after you've been exposed to those viruses again and again. Whatever the explanation is, it's a fact that kids become very febrile, and I try not to let that scare me. So in children, every rhinovirus is high fever. I try not to get scared by the number in front of me or how high it is, but rather try to pay attention to the tachycardia. So as we mentioned, tachycardia in and of its own, especially tachycardia that is unexplained, could be a clue that the child is actually septic or has a serious infection or something else is going on. So if a child is febrile to 104 with runny nose, cough, congestion, viral symptoms, and is very tachycardic, I pause for a second, maybe I give Tylenol and reassess the situation. But if the child is still tachycardic after the temperature came down with some Tylenol, drank something, is not dehydrated, that makes me a lot more concerned. If the temperature came down, if I don't believe the child is dehydrated, why is he or she still tachycardic? That to me is a lot more concerning. So remember, physiological response. In children, every rhinovirus is a high fever. Don't let that scare you. Check that heart rate, bring the temperature down with Tylenol if you need, make sure the child is hydrated, and if there's no more tachycardia, send the child home. I do want to make sure I mention that in my anecdotal experience, rule number 135 doesn't apply to adolescents. So I think of adolescents as more like adults, and in adults and adolescents, for the most part, fever is a bit of a red flag. For the most part, in that age, rhinovirus and the cold viruses don't cause fever. So if I see a febrile teenager, I try to open my mind, and usually I'm able to pinpoint the diagnosis. Nothing necessarily serious, maybe just influenza or COVID. A lot of times I find mononucleosis, but generally speaking, I don't find that teenagers become highly febrile from benign cold viruses. So I'm a little bit more hesitant to diagnose URI in a teenager that is febrile. Again, not to say that he or she have sepsis or serious infection, but I open my mind just a little bit. So remember rule number 135. Every rhinovirus is high fever. Don't let that scare you. Then again, doesn't really apply for teenagers. Rule number 136. Make a recommendation to the parents. Don't tell the parents what will happen, just make a recommendation. So this rule, I think, goes back to shared decision making that just leads to better care and better results and better parental reassurance, which will hopefully prevent the next unnecessary visit. So when I see patients in the pediatric emergency department, and after I examine the child and I try to make a plan with the parents, I always bring it up as a suggestion. So mom and dad, little Johnny certainly has cough, I heard it, and I see the temperature is elevated. My recommendation is that we obtain a chest x-ray and make sure there's no pneumonia. And if there is no pneumonia, I'm sure little Johnny just has a cold. I recommend you do XYZ and continue supportive care at home. On the flip side, I can maybe say something like this. Okay, mom and dad, I see that little Johnny has runny nose and the congestion. However, I don't hear anything in the lungs. The ears look okay. The throat looks okay. I recommend you go home and continue to give him fluids. Make sure he has no difficulty breathing. Make sure you're seeing some wet diapers, etc., etc. The bottom line is I make recommendation to the parents. I don't tell them what will happen. I recommend what will happen and have that process of shared decision making, letting them express their opinion, listening to their opinion, and see how they feel. So make a recommendation. Don't tell parents what will happen, just recommend what you want to do. Rule number 137, work up the fever for over 5 days, or at least think about it. I think we all know very well the relationship between prolonged fever and Kawasaki. Every time I hear a fever for 5 days, I think about Kawasaki. I look for a rash, I look for mucous membrane changes, etc., etc. If I see none of those, I make sure I document that and I feel better about not missing something. However, I think it's easy to think about Kawasaki and I think it's easy to prove, quotes, that the patient doesn't have Kawasaki by history of physical exam. However, what I often see people forget, myself included, is to think about other infections or other sources of fever when the child has fever for 5 days. I'm not sure how evidence-based that approach is, but my personal experience is that when the patient has fever for 5 days, yes, it can still be a virus, but those are the situations sometimes when the patient actually has UTI or even subclinical pneumonia that is yet manifested with respiratory symptoms but will be evidenced on a chest x-ray. So when I see a child with fever for 5 days, especially if they're ill appearing, especially if they're very tachycardic, I think about a little bit of a workup, namely a chest x-ray and a UA in the appropriate situation, especially if it's a girl, especially if it's a toddler, etc. I don't always work those patients up, but at least I think about it. I think about Kawasaki, I think about subclinical pneumonia, and I think about UTI. So keep that in mind. Work up the patient with a fever for 5 days or longer, or at least think about it. And that is it for today, guys. Thank you very much for listening, and thank you for supporting PEM Rules. Let's review what we learned. Rule number 135. Every rhinovirus is high fever. Don't let that scare you. Remember, kids become febrile very easily from very benign infection. Don't let the number on the thermometer scare you too much. Look for the unexplained tachycardia. Rule number 136. Make a recommendation. Don't tell the parents what will happen, just make your recommendations as to what should happen. Rule number 137. Work up the fever for over 5 days. Think about Kawasaki. Document that you don't have any evidence of Kawasaki, but remember, UTI and pneumonias unfortunately still do exist and can be subclinical with patients presenting with fever only. So work up the patients with fever for 5 days, or at least think about it. And that is it for today, guys. Thank you very much for listening. I appreciate it. Please continue to check out PEM Rules and contribute however you can. I love hearing from you guys. I love hearing the suggestions you have for rules. Obviously, we'll give you the credit if your rules come on the show. And if you want to come on the show as a guest, tell us about how you applied PEM Rules in your clinical practice. I would love to hear about it. The next outro is one of my favorite songs by Lenny Kravitz. It's called Fly Away. Hope you like it.